I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a significant portion of that time correcting what men over 60 are being told about sexual performance and natural remedies. And today, I want to address something I'm seeing all over the internet right now: the claim that combining honey and cinnamon before bed can meaningfully improve erectile function and sexual performance overnight. You've probably seen the videos. You may have already tried it. So today, I'm going to tell you what the clinical evidence actually says. Not what wellness influencers say, not what supplement marketing says, but what the peer-reviewed research shows. And here's the thing: the answer is more nuanced than a simple yes or no. Because some of what's being said about these two ingredients has a real basis in physiology, and some of it is dangerously oversimplified in a way that causes men to miss what's actually driving their symptoms. I'm Dr. Emily Carter. Drop a comment below and tell me what you've heard about honey and cinnamon for men's health. I want to know exactly what's circulating out there, because the misinformation I'm seeing my patients arrive with has become remarkably specific. Here's what men over 60 are typically being told. Honey gives you energy and boosts testosterone. Cinnamon improves blood flow and acts like a natural Viagra. Take them together before bed and you'll wake up with noticeably stronger erections. That's the claim. And the reason it spreads is because it contains just enough biological truth to sound credible. The mechanism is partially real, and that's exactly what makes the oversimplification dangerous. Because men hear the partial truth, they start mixing honey and cinnamon every night, they feel a mild placebo effect for a week, and then they stop asking about the actual clinical issue that is driving their symptoms. That delay can matter. Let me explain why. Let's start with what the clinical evidence actually shows about honey, because this is where the biology gets interesting. Raw honey, particularly varieties high in phenolic compounds such as tualang honey and cedar honey, has been studied for its effects on male reproductive health. A study conducted at the University of Putra, Malaysia, followed 76 men over a 12-week supplementation period using tualang honey and found measurable increases in serum testosterone levels compared to placebo controls. The mechanism identified was antioxidant activity, specifically the reduction of oxidative stress in testicular tissue, which is known to impair Leydig cell function. Leydig cells are responsible for testosterone synthesis. When oxidative load in that tissue decreases, Leydig cell output improves. That is a real biological pathway. It is not folklore. However, and this is where clinical precision matters, the testosterone increases observed in that study were modest. We are not talking about the kind of hormonal shift that reverses years of age-related testosterone decline. We are talking about incremental improvements in a specific biological environment. The men who benefited most were those with elevated oxidative stress markers to begin with. If your testosterone decline is driven primarily by other mechanisms, and in men over 60, there are several, raw honey will not compensate for that gap. There is also relevant data on honey and nitric oxide production. A 2012 study published in the Journal of Agricultural and Food Chemistry found that polyphenols in honey can upregulate endothelial nitric oxide synthase, the enzyme responsible for producing nitric oxide in blood vessel walls. Nitric oxide is the primary vasodilatory signal involved in erectile function. Without adequate nitric oxide signaling, the smooth muscle tissue in penile vasculature cannot relax sufficiently to allow the blood flow required for erection. This is not controversial physiology. It is the same mechanism targeted by phosphodiesterase 5 inhibitors, the class of drugs that includes the most commonly prescribed treatments for erectile dysfunction. Honey does not block PDE5, but its polyphenol content may support the upstream production of nitric oxide that those drugs work to preserve. That distinction matters clinically. Now let's talk about cinnamon. And here is where I have to be more careful with you, because cinnamon research is both genuinely promising and frequently misrepresented. The most robust body of evidence for cinnamon relates to insulin sensitivity and blood glucose regulation. A meta-analysis published in the Annals of Family Medicine reviewed 10 randomized controlled trials involving 543 participants and found that cinnamon supplementation consistently reduced fasting blood glucose, LDL cholesterol, and triglyceride levels in patients with type 2 diabetes or prediabetes. Why does this matter for sexual performance? Because metabolic dysfunction is one of the most significant and under-recognized drivers of erectile dysfunction in men over 60. Insulin resistance damages the endothelial lining of blood vessels. It reduces nitric oxide bioavailability. It promotes systemic inflammation, and it impairs the hormonal signaling pathways involved in sexual function. When cinnamon improves insulin sensitivity, it is removing one of the root-level obstacles to vascular health, and vascular health is erectile health. A study from the University of California, Davis examined the effects of cinnamon extract on endothelial function specifically. The researchers found that cinnamaldehyde, the primary active compound in cinnamon, inhibits platelet aggregation and demonstrates vasodilatory properties in vascular tissue. The sample size was limited, and the study used concentrated extract rather than culinary cinnamon, but the mechanism is consistent with what we understand about endothelial function and blood flow. Here is what I want you to understand about the before-bed timing specifically, because this part of the popular claim is where the clinical logic is most distorted. There is no peer-reviewed evidence suggesting that consuming honey and cinnamon specifically before sleep produces a time-dependent effect that leads to superior erectile function by morning. That framing is marketing language, not clinical language. What the evidence does support is that consistent, sustained consumption of foods with demonstrated effects on oxidative stress, insulin sensitivity, and endothelial function produces cumulative improvements in vascular health over weeks to months. The mechanism is chronic, not acute. You are not taking a compound that acts within 8 hours and resets your physiology overnight. You are introducing antioxidant and metabolic support that over time may reduce some of the vascular burden contributing to performance decline. The by morning framing is clinically misleading because it encourages men to evaluate whether it's working after a few nights. And when they don't notice a dramatic difference, they conclude it doesn't work, when in reality, the relevant biological changes were never going to be visible on that timeline. Now let me tell you what men over 60 are often missing when they focus on natural remedies like this one. Erectile dysfunction in this demographic is predominantly vascular in origin. Multiple large-scale studies have confirmed that ED is a strong independent predictor of cardiovascular events, meaning that for many men, declining erectile function is the first symptom of systemic endothelial dysfunction, the same process that leads to atherosclerosis and heart disease. A prospective study from the Massachusetts Male Aging Study, which followed over 1,700 men across a 9-year period, found that men with ED had significantly higher rates of major cardiovascular events compared to matched controls, and that this association was independent of traditional risk factors. The erectile symptom appeared years before the cardiac event in many cases. I tell men this not to alarm them, but because it changes the clinical priority. If you are over 60 and noticing meaningful changes in erectile function, the correct first response is not to start a nightly honey-cinnamon protocol and wait. The correct response is to have a conversation with your physician that includes fasting glucose, HbA1c, lipid panel, testosterone, and a cardiovascular risk assessment. Natural interventions may absolutely play a supporting role in your overall health strategy, but they are supporting, not primary. What I see clinically is that men delay that conversation because they are trying a supplement protocol that makes them feel like they are doing something. And by the time they come into my office, what started as a manageable vascular issue has progressed. That delay is the real cost of oversimplified wellness content. So let me give you an evidence-based framework for how to approach this correctly. If you want to incorporate honey into your diet for its antioxidant and potential hormonal support benefits, choose raw, minimally processed honey, preferably darker varieties with higher phenolic content. A consistent daily amount of 1 to 2 tablespoons provides the polyphenol load used in most research contexts. Processed commercial honey has most of its active compounds degraded. The timing is not clinically significant. Choose a time that supports consistency. For cinnamon, the evidence supports Ceylon cinnamon rather than cassia cinnamon for regular consumption. Cassia cinnamon contains coumarin, which in high doses is hepatotoxic. Ceylon is the variant used in most clinical research and is the appropriate choice for daily supplementation. Half a teaspoon to 1 teaspoon daily, incorporated consistently, is the range studied in the metabolic research. If you have diabetes or are on blood glucose medications, speak with your physician first. Cinnamon has measurable glucose-lowering effects and can interact with your dosing. Neither intervention is a substitute for addressing the underlying drivers of age-related performance decline, which include testosterone status, cardiovascular health, sleep quality, body composition, and psychological factors related to performance anxiety. Each of these has a more substantial evidence base for impact on erectile function than any dietary supplement, and each deserves clinical attention. Gentlemen, what the clinical evidence tells us is this: you have not been failing at managing your health. You have been given incomplete information and asked to work with it. The wellness industry takes real science, and honey and cinnamon do have real science behind them, and strips out all the context that would help you use that information correctly. The mechanism is real, the timeline is not. The benefit is possible, the scope is limited. And the clinical risk of using these interventions as a primary strategy rather than a supporting one is that it delays you from addressing the vascular and hormonal factors that are actually driving your symptoms. You deserve the full picture. That is what I try to give you every time. Before you go, tell me one thing you believed about honey and cinnamon or natural remedies for performance that this video changed for you. Leave it in the comments. It helps me understand what information is actually reaching men out there so I can keep addressing it directly. I'm Dr. Emily Carter. The clinical evidence shows that honey and cinnamon offer real but limited vascular support. And the most important thing a man over 60 can do for his sexual health is not start a supplement protocol, but start an honest conversation with his doctor. Take care of yourself, and I'll see you in the next one.